Well, hello everyone and welcome to today's webinar. My name is Dawn Van Dam and I'm the president of 1 Million Solutions in Health. I'm excited to have the opportunity to bring this webinar to everyone today. We had quite a few people register, but I know that because a number of them are physicians, that they probably are going to get stuck in their practice and not able to watch this directly in live time. So I really appreciate the fact that we can record this and share it with everyone after the fact. As I was looking at the registration list this morning, I saw people from Europe and from Asia, so probably some of them are actually asleep this morning or in their morning or in the middle of the night. But with no further ado, let me tell you a little bit about our presentation for today and introduce our speakers, and then turn it over for an exciting overview of a very important topic. How to make yourself more efficient and more successful in managing your pediatric practice. So just an overview of today's presentation. The efficiency and ease of use of an electronic health record can be the determining factor as to whether a physician practice thrives or fails. With 67% of physicians reporting that they're unsatisfied with their current electronic health record, or EHR, and 60% indicating that they want to make another electronic health record choice, it is rather evident that there is a shortage of highly efficient and easy to use EHRs out there. So before choosing a new pediatric EHR system, it is important to fully understand how it can truly benefit a physician's practice. Asking key questions can quickly determine if an EHR system will deliver on the needs of a practice or fall flat. This webinar is designed for pediatricians and primary care physicians that want an EHR that lets you practice medicine the way you want to practice medicine, with an ability to optimize your time, your billing, to balance your practice and balance your life, to provide the best patient care and have a happy staff. Today we'll also be hearing from this electronic health record from Excite Health, which is actually also ICD-10 ready, so that'll be, that's great news for everybody. So just a tiny bit about 1 Million Solutions in Health. Our goal is to share solutions in healthcare and in life sciences and for patients and consumers all around the world by shaping healthcare and by sharing those solutions with everyone and helping them collaborate and helping them learn about things and kind of accelerate the adoption of that science. How we do that is we help people connect, we help people learn and share, we share the innovations, whether it be from academia, government, entrepreneurs, or businesses. So if you're sitting in today's webinar and you have something you'd like to share, please contact us. We would love to have you and your topic be a part of a future webinar. And we have a number of initiatives to help people collaborate through our various technology evaluation consortiums. So I will now move into introducing our speakers for today's webinar presentation. So Dr. Roy Benaroch, I'm going to tell you a little bit about his background. So he is a pediatrician and adjunct assistant professor of pediatrics at Emory University and author of a number of books, and he is located in Roswell, Georgia. Dr. Benaroch completed his residency through the Emory University affiliated hospitals in 1997 and then served as chief resident and instructor in the Department of Pediatrics. He has continued his involvement on the Emory faculty as the adjunct assistant professor of pediatrics. He was board certified in pediatrics in 1997 and joined Pediatric Physicians PC in 1998. Now, with over 20 years of experience, he has written 2 books for parents. First one, Solving Health and Behavioral Problems from Birth to Preschool, A Parent's Guide. And the second one, A Guide to Getting the Best Healthcare for Your Child. He also writes and serves as a pediatric expert on WebMD and many other websites. His blog, The Pediatric Insider, features more of Dr. Benaroch's essays on many parenting and health topics. And with the great courses, Benaroch has created a lecture series of mystery medical cases for laymen called Medical School for Everyone, Grand Rounds Cases. So Dr. Benaroch will be our featured speaker for today. And I'd also like to introduce our other speaker who will come in towards the end, who is Barry Hyatt. Barry is founder and CEO of Excite Health, and his areas of focus over his career have included online marketplaces, consumer internet, and healthcare. Barry has been instrumental in developing and marketing global platforms that can reach hundreds of millions of participants that grow more relevant to its users over time. In fact, prior to Excite Health, Barry was previously the CEO of Modern Medical Modalities, which owned and managed multiple outpatient radiology centers. From 1992 till 2003, Barry also served as a corporate finance and investment banker, helping entrepreneurs as well as companies with various financing needs who were trying to go public. He has experience in building winning teams, operations, and corporate governance in order to build companies and shareholder value. Barry received his bachelor degrees in business administration and economics from Hebrew University in Jerusalem, Israel. So, with no further ado, I'm going to turn it over to our main speaker today, Dr. Benaroch. Just see if I can get his picture up there.
There I am.
And there you are. And with that, I'm going to pass you the ball and let you take us through a demonstration of the Excite Health electronic health record focused on pediatricians and family practitioners, and how it's ready for use today and ready for use come that October 1st deadline for ICD-10. So over to you, Dr. Benaroch.
Thank you. Thank you, Dawn. I appreciate the introduction. As Dawn mentioned, I'm a practicing pediatrician. I'm actually in my office today. I was seeing patients this morning, and I have plenty more scheduled this afternoon, but I'm happy to take a little time here during lunch to show you a demo. So I'm going to take the view that you're seeing, and I'm going to show you the view that I see from my office, which I believe I have now done. Does everybody see my office view there? I think so.
Yep, we're good.
We're good. Okay. So this is a view of the Excite Health EMR. We're already checked in. Let me just log off for a second so we can pretend we're walking into an exam room. This is what you'd see on the computer screen. You click here and put in your little passcode, and now you're into the view. And we're looking at the waiting room first, where we can see there are two patients waiting, Peter and Teresa, who I guess are brother and sisters. They have the same last name here. What I'm going to do first is do, just so you see it, a little bit of what the nurses typically see, sort of pretend to be a nurse for just a couple of minutes, and then we'll do the doctor part, which I think is more what we want to concentrate on, but that way you'll see where the information comes from that the doctor will see. So the nurse will bring one of these patients back. Let's start with, let's do Teresa, I think, if that's okay, and we would be in one of the rooms. Let's say we're going to start with exam room 3 here. When the nurse walks into the room, she would have seen this screen first, this empty screen. There's no patient currently here. Get patient. Let's bring back Teresa. And the next screen that comes up asks for what you would expect the nurse to take first, the chief complaint and some other information. So we'll say chief complaint is, let's do bee sting. Over on the left here, there's some very common words that can be quickly chosen. If instead of bee sting, you wanted to say they've had a fever, perhaps for 7 weeks. That sounds a little silly. Let's change that to 7 days. You could do that. That will sort of automatically populate here. 7 days onset, like that. So for people who don't like to type a lot, you can just start with this list. This is one of many, many lists throughout this EMR that's entirely user configurable. Those of us who type tend to not use these lists as much, but many people don't type as well, and they like to rely on these. So you could say fever beginning 7 days ago, and for instance, sore throat, let's say that began 1 day ago, and then you've had vomiting, that began 3 hours of the last 3 hours duration. So that was pretty quick, but again, I don't want to focus too much on this screen. This is usually information that the nurse will put in, and you can see how quickly they can generate a nice chief complaint. This got a little bit complicated. Let's take out some of this. We're just going to say fever and sore throat. That sounds like a good chief complaint. Okay. And then we also have our nursing staff collect the basic vitals. Let's see, this is a 15-year-old, so we'll make her a nice 130 pounds and 62 inches. You can configure this in metric for those of you who prefer. We typically would then do a temperature. We're sort of still wedded to the English units here and a blood pressure. Anyway, I'm going to skip some of this now. We also added this recently back in January, February, when there was concern about Ebola virus. We added in a section where our nursing staff was taking out information about foreign travel and exposures. So would have put something like that: no travel to West Africa, or no foreign travel in the last month. We added that in there. Okay, so that's the chief complaint screen. We then have our nurses go through a list of the medications that the child is taking. This will include medicines that we've prescribed or medicines that were prescribed elsewhere. Now, ironically, as sometimes happens with test patients, it looks like Teresa was already seen with strep throat a couple of days ago, and I went ahead and gave her a sore throat and fever today, but that's just really a coincidence. This was reflecting this last visit where she was evaluated for seizures and for strep throat and was prescribed amoxicillin and is taking Keppra as well. The nurses then ask about allergies at every visit. We can see that she, in the past, was noted to be allergic to sulfa medications, and notes the severity and what the reaction was there. The nurse at this point says, just confirm that, and if the family says, yes, that's still true, we click one-click reviewed, and that adds a little note. This next thing is, I don't know that many of the practices have done this. This was our own little homegrown little screen that we put into the sick work plan. What we were trying to do is capture children who hadn't had a well check in a long time. And this is just a very simple screen, but it pops up and the nurses see it, and it says, on this case, with Teresa patient, has not had a well check at our offices. If she had had a well check within the last year, it would say the date, had already had a well check, lotted on, put the date. But since she hasn't, it says, please suggest parents schedule a well check. If parent wishes to schedule a well check, click here. So the nurse now at this point could have said, oh, I see you haven't had a well check at our office. Would you like to schedule one of those? And if the parent says, no, thank you, that's fine. But if the parent were to say, yes, we'd like to do that, what the nurse would do is click right there where it says here. And this sends a little message to the administrator at the front desk to offer to schedule a well visit. And we'll see what that looks like after the patient checks out. So we sent that over. Now this screen, I don't think that's a standard part of the EHR, but it's just an example of some of the things that we've done at our practice. In this case, specifically to increase visits, to make sure kids come in for those well checks. Okay, finished. We're done with that screen. What would happen next is actually this. You saw that preview popped up because I was acting like a nurse, but ordinarily a nurse would do that, and now the nurse would now have left the room, and the patient waits for just a few minutes, and now I've walked into the room, and now I check in, and I see this. This is the screen I'm looking at when I check in to see Teresa patient. See that green bar up there? That was that offer to schedule well visit that I sent. In our office, green means something for the front office staff to do. This blue color is my personal color. This is Dr. Roy. This is me. This is something for me to do. And one of the super strengths, I think actually really the thing I like most about this EHR, the biggest strength, is exactly what you're seeing here, that at just a little quick glance we can tell what has to get done and who's supposed to do it. So someone at the front is supposed to offer to schedule a well visit, and I'm supposed to look at this preview view. And we'll have other examples. I'll put up a couple more services so you can sort of see what the power of this is, that multiple people can actually help out Teresa and do things at the same time efficiently. I don't have to wait to get out of the room to tell the nurse something. She actually knows what I need to get done as soon as I think about it, and she can start working on it. Okay, let's continue with the visit with Teresa. And by the way, for those of you participating, I don't see from the view I'm looking at, I can't see the chat screen or the Q&A screen. But I believe if anybody has any questions, you could just speak up and interrupt me. I know I might go fast, so if you want me to clarify, please speak up.
Yeah, I'll be monitoring.
Okay,
I'll be monitoring the chat, and
yeah, you let me know, because I realize I don't see that other screen. I just see my office view. Okay,
yeah.
So let's do this. Here's the first thing that I see when I go in. I see this preview, and there's my nurse's chief complaint that she took a few moments ago, fever beginning 7 days ago, and the vital signs are here. That comment about the no foreign travel. Underneath here, it shows open prior diagnoses, and that includes the strep and the epilepsy that she had been in here for a few days ago. This closed sick diagnoses here would be things that she was seen for in the past at our office, but were closed. Closed diagnoses are things that are really no longer relevant, like an ear infection 2 years ago, or that she broke her toe last year or something like that. Those are still in the chart, but we refer to those as closed diagnoses because they're not active, they're not really at the front of our minds right now. So I've looked at our preview and I click finished. And here we're going to get sort of what you'd think of as the chart view. This is the main central view of this of Teresa patient's chart. It shows some of the same information you've seen before. The things in blue here are what is happening today. Okay, this is today's child vitals, and we've already gone through those. You can also see the past strep and the past seizures here. What else is useful, right? At first glance from this screen, see how the word allergies is in red here. That's just an extra clue you in that there's a drug allergy. We can also see it here on the assessment list. They're allergic to sulfa. In pediatrics, we're very, very keen on vaccinations. At our practice, I don't know that everyone else does this, but we like to at least briefly review the vaccine record at literally every visit, including every sick visit. The fact that this word VAC is in red tells you that this particular child is overdue for some vaccines. And for the details, we could click on it. Now, this is a test patient. Let's look at the detail. Yeah, this test patient, we've never actually entered an immunization record. I think I have another patient maybe we'll do a well encounter on a little bit later, and I'll show you something more useful. Of course, as far as our computer knows, Teresa does need vaccines today, but we just hadn't set her up for the test patient. So we could talk about vaccines with the patient if she was really due for them, or we could launch into talking about the chief complaint. I'm going to now show you what I would do next for what's called the provider work plan. The part that I do starts here. This is a sick encounter, so I click the sick visit. This is the past medical history from before she joined the practice. If one thought to review this, you can review it. You can add more information there if you want to as well. Now I'm going to take our ROS. We call it the review of systems with HPI. This can be configured as well for those of you who want to take a separate HPI and a review of systems. You could do that. We sort of mash it all together. There's multiple ways to do this because in our practice, some of the doctors like to type more than others. I will admit I'm a little bit of a typer, so I use this top one, this freeform one, and here I can type whatever I want to type. So, has had a sore throat, ... I could also use these phrases over here. She's had no diarrhea, no vomiting, and no ear pain, for instance. Other physicians in my group prefer not to type quite as much, and they use these HPIs. So, for instance, the constitutional HPI here, this was set up to just yes, no. So, no fever, no dizziness, no weight gain, no weight loss. And that shows the same information. It's just more oriented to physicians who feel like doing a little bit less typing. And this is all configurable by the practice. You can set up these HPIs on your own. Here's a URI HPI. In this case, yes to sore throat, no stuffy nose, no cough. And if you do get a sudden urge to type something, even from this screen, you could type as much as you want. You just click on this text button. So if you wanted to clarify sneezing, you could type in here only when around the cat or something like that. Okay, so that was our HPI. We're done. Now we've got our physical examination, and again, you have different ways to do this. In our practice, we've set up these what we call stock examinations. They're over here on the right, and we find that most children can have one of these stock examinations applied, and then you can tweak it to change what was relevant. As you can see, we have a basic exam, otitis media right and left, sore throat, cold, sinusitis. This stands for brief normal newborn, and there's a few others. In this case, we're probably going to do, let's just assume she had an exam consistent with a sore throat, pharyngitis. We click there, and it populates, and this shows, just as a for instance here, posterior pharynx is red. Let's say you wanted to add to this that she had, I don't know. Let's say she had big lymph nodes. Okay, so we're going to add that. We can go to the lymph node section here and type, for instance, she had abnormal anterior cervical lymph nodes. Okay, and you could put more details in there about the size if you wanted to. Click, 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 but you're done. And that was very, very fast. Now we come up with our assessment, and at this point, we know she has a sore throat. You know what? Let's pretend that she wasn't here a few days ago with strep throat, because medically speaking, that kind of makes this an unusual visit. Let's say this is a new visit and she hasn't had a sore throat. We're going to diagnose her with. We haven't done our strep test yet, so we're going to diagnose her with not having strep, and we're going to order a rapid strep test. I'll show you what that does. Symptomatic treatment. Go gargle with some warm salt water, and we're done. That's really all we need for a sore throat visit. We're going to have the nurse do this rapid strep test. Let me show you what that means. We made our diagnosis, we ordered our things, and in our work plan, it forces you to choose something about the follow-up We thought that this would help fulfill insurance company requirements, so you can choose follow-up as needed, follow-up if new concerns, or actually schedule a specific follow-up. Let's just say follow-up if worsenings persist. That's good enough. So here's today's chart. We're actually done with our charting, and it shows our review of systems here and our physical examination here. Look at that one thing. There's one service, though, that's highlighted. It's right here. This is the one that we still need our nurses to do, and this is what I meant when I said that business about the work plan, about all of the employees in the building helping out and doing their jobs. We think we're done. I'm going to click Exit. I can review my billing here. We're going to bill at 213. There's our diagnosis. We did the strep test. Yep, that looks right to me. In all honesty, I usually don't even bother to look at this because it's usually correct, and I'm finished. And now I'm ready to go to the next room. I'm ready to see my next patient, but there's some things for my staff to do. In green, somebody wants to offer to schedule that well visit, and in pink, there's do a rapid strep, because pink is the color that my nurses use. When they see a pink bar, they know they have to do something. So I can leave the room. The nurses see the pink bar. They click on it. One nurse can go and collect it. And this has to do with leaving the results of the throat culture. That's a little thing we like to know if we can leave it on their answering machine. We added that to this template. And then another nurse, 5 minutes later, ding, 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 5 minutes went by, can go in here and put in there that it was negative. And they're done. If it was positive, my nurses will put up a blue bar saying strep test was positive, go back and write for some antibiotics. And I'll see that before I go in to see the next patient, and then I'll go back to Teresa. So that visit, I did a fair amount of talking, I know, which really slowed me down, but a good sore throat type of visit like that to do all of the charting would be, oh, I don't know, 45 seconds tops or something like that. And not only did I get a good note that's medical legally appropriate, it's got all the medical details that my partners might need later on, it generated a good bill, and it told all of my staff what they were supposed to be doing all at the same time. And Teresa's happy, and my staff is happy, and I'm happy because I get to go see the next patient. Okay, let's do that. Matter of fact, let's do this. Before we go to the next patient, telephone room, that's lit up. It's in red because I have a phone call. So as you know, in pediatrics, we get a lot of phone calls. There's one in pink that says, please call mom. That means that that's pink is still the nurse caller. The nurse is supposed to pick that off and call the mom. But I've got one in blue. So I can answer this phone call very quickly in between patients. I don't know what this is. Question about meningitis. I click on it, and it says here, child with meningitis at tomorrow's school, does she need to take antibiotics? So I might put in an answer. You know, I need to get more information. In this case, what kind of meningitis, but I would put in an answer just for instance, yes, does need antibiotics, let's just say. And then in fact, I could very easily go into the chart here, and I could make a new diagnosis of exposure to, we'll call it exposure to communicable disease, right there. And, you know, I haven't used this diagnosis a lot. When you use them, there's some pre-populated things here, the stuff that you usually use for this diagnosis, but we don't have one here, so I'm going to put this, how old is Tamara? She's 6 years old, so we would put her on Bactrim. I'm just going through this quickly. There you go. I don't know that I picked the right dose, but I picked a dose. And then I can confirm it. Wait a minute, that's not right. I want to do a different dose. But we'll leave it at this just for the sake of this example. Let's make it BID. Okay, good, finished. And now the nursing staff knows, call in med, and I'm done with my phone call. And now there's no more blue bar here. I did my part. Now instead of a blue bar, there's a pink bar for the nurse to call them back to tell them they have to take their medication. Now we set this up as a test room, so I guess the SureScripts didn't work. Typically there's a little white box here where we don't see there. It says manually print this prescription. Usually that won't pop up because we use SureScripts to send scripts electronically. And you'll just have to imagine with me, I guess because this is a sort of a test situation here, the Excite didn't set me up with so you can see the SureScripts. But you would click right there, and then you'd pick their pharmacy, and you'd click send, and that's what you would have to do to send that prescription over. All right, so we're done with the phone room. We did our phone call, and it turns out that we have a checkup waiting for us, poly patient. I set this one up. I started this encounter this morning before I started seeing patients. So it looks like this poor Polly has been waiting 249 minutes. But of course, that wouldn't hopefully happen in my practice. And here's Teresa's. I didn't even point out this number, but that offer to schedule well visit, we did that 12 minutes ago. So people can easily keep track of how many minutes people have been waiting. In this case, let's just pretend that she hasn't been waiting that long. So I already did the nurse part of this visit, including taking the vital signs and doing a developmental screen and things like that. And when the nurse finished up her job and clicked through her screens, this pink bar showed up for her because it turns out that at 6 months, we always do a hemoglobin. And you guys may or may not do that at 6 months. All of this is user configurable. But we have in the checkups, what we call the work plan, we have it to automatically have the nurse do a hemoglobin. So they would see this pink bar, and they would click on it, and they would put the result in. Let's say Polly's got a hemoglobin of 12. Done. And now their little pink bar has gone away. And taking care of that pink bar could take place before I saw the patient or after I saw the patient. It's kind of independent of what I have to do. That's keeping everybody optimized, keeping everybody busy. If any nurse had a free moment, she could have gone in to take care of Polly's hemoglobin. It didn't even have to be the same nurse who brought her back, actually. Okay, now it's my turn. I'm going to do my well preview. And this was some information I typed in this morning, but pretending to be a nurse. Here for a well check, has a rash on the face, sleeping problems, and then you've got some vitals and things here. Now I'm going to see the chart view. And here's little, what is her name? Polly up here. We can see that she was seen for an ear infection a few days ago and prescribed Septimir or Omnicef. That also appears in this med box for sort of a quick glance at that. This patient is also allergic to amoxicillin. Oh, there's our hemoglobin. I mentioned that. That's the result the nurse just put in a moment ago. That's your 12 if you want to see that. Let's take a look at Polly's. I don't remember if she has an appropriate vaccine record or not. Oh, she does. Good. Okay, this turned out to be a good example. So someone has gone through and put in, even though this is a test patient, put in the typical vaccines that she would have gotten at birth and at 2 months and at 4 months. This detail page is not a page that most of us ever even need to look at. Usually, you just look at this page here, right under the VAC tab, and what it shows you is the things in green are the things that she's due for today. And the order of this is configurable. We deliberately set this up. The reason we put DTP, polio, and Hep B kind of clustered together here is because we use the combo Pediatric. So this is easy on the eye. You can see she needs her Pediatric and her Prevnar and her rotavirus. And there's very robust logic behind the system to make sure that it prompts you for the correct vaccines at the correct visits. Even if you have some families transferring in who had, got vaccines in a different order, or you have the occasional mom, dads want to space these things out or do whatever crazy stuff, this will keep track of it for you to help keep people giving the right vaccines at the right time. Let's go back to that first chart view. We were looking at that. We also, at the start of the visit, I'd like to look at this tab. This Dev tab here shows you the growth charts. I will admit that it looks like the height and weight I put in here were a little bit strange for poor Polly. Sorry about this, Polly. But I made you lose an inch of height since your last visit, which gives you a funny-looking percentile. From this view, you can see everything just lined up, the percentiles and the exact amounts. Or from this tab here, you can see her CDC growth charts. Her weight looks good. Poor Polly, I made her shrink there. That was just poor data selection by me. And you can also see her head circumference. Oh, I didn't get that one right either. That's what you get from making up data early in the morning. Anyway, we can look at that and talk to Mom about it. Now we're going to start the meat of our well check, and this is very configurable. Remember, last time we did the sick. This time we're going to do the well. And the screens that pop up for both the sick and the well, you can configure with the help of Excite, or you can configure it yourself. We like to start with that past history screen here. Then when you're done reviewing that, we like to have our staff take a diet and sleep history. So you can skim through this. This is a nursing baby who wakes frequently at night. Okay. We do a brief developmental screen first, which is just a couple of questions at some of these key ages. Here at this age, we actually only ask 2 questions about sitting and rolling. But then we also do a formal developmental screen. this is using the PEDS. I don't know, some of you listening to this, watching this might also use this. This is the PEDS instrument, which as is a developmental screen, and you can go through these and record the information that the parents put on that PEDS developmental screening form. Rather than click one by one, you can click the Set All button, and then we have some text like this one, no predictive developmental concerns, and OK. And then we're done. That was our PEDS form. Now we can do the same ROS HPI. You saw this screen before, but you could type here, for instance, some more details about, what was it? Rash on the face, rash seems itchy. You could say, you know, has tried cream, something. You know, you could put as much HPI here as you want, and again, you can either freehand type it, or you can use these prompts here, and you can add your own prompts over there. It's really very, very easy to do this, just on the fly, really quick. Let's say we want to add rash. Let's say you want rash as a prompt, a word that you like to use. Type it, click Add to List, and that's it. It's there. And you could use this. This time we could say it's had a rash for 6 months. Bam, just like that. That's how quick it is to set this up. And you can set up these lists like this. See, it says personal here. It can just be your personal. Every nurse and every doctor has their own set, or they can be shared by the practice. That's called a common list, and you could set those up if you wish. Anyway, so very, very quick either to type or to enter these things in without typing. Oh, I just erased it. Okay, let's just say, what did I say? How long do they have the rash? I forget what I said. I've had rash for 2 weeks. Okay, good enough. Okay, now we get to our physical examination. And we've set up before you had seen sort of the sick exam for the pharyngitis that populated this. This time we have a more substantial exam we call PE female. For a physical exam, covers every organ system. And by the way, the ePro knows if this is a male or a female, so if this were a male, this would have said male. It doesn't offer to do a female exam on a male, obviously, because it looks a little different. And if you want to apply this exam here, this is an all-normal, thorough physical exam on a female. Click, and there it pops up. And the exact things here you change by your practice. If, for instance, in your practice you, I don't know, never do neck exams, you could leave this out and not have it part of your stock exam. It's very, very quick to change either the stock exams or even, I'm going to clear this just for a moment, even a stock exam for just one body part. So you want a normal heart exam, you can click there and up it pops. And if you want a normal respiratory, and all of this you can configure very quickly on the fly. I can show you guys how to do that if you want later. Okay, we're done with our physical exam. The anticipatory guidance prompts come up next, and we can say that yes, we talked about feeding, yes, we talked about sleep, yes, we talked about vehicle safety. All of this, of course, very user configurable. You can add a text here, click there, and add a comment to any of this if you wanted to. Done. Chart alerts pop up here, and this would be things to alert you about very specific circumstances, like I don't know, something unusual. Oh, okay. Let's say at this point, if Dad insists that vaccines only be given one at a time or something, and you wanted to keep that in mind, you could use that as a chart alert. That's just an example, and type that in, and it would pop up at this point so that the providers would see it. This patient doesn't have any alerts. Most patients don't have any alerts. And then you get your treatment list for this 6-month well visit, and these are different at every well visit. 6 months, of course, is different from 9 months and 12 months, etc. This is all very, very configurable, sort of in a similar way I showed you adding things to that text screen. You can add or take things off of these screens as well. You can have a version of this treatment list just for you. That would be a personal list, or you could make it a common list for the whole practice. This is common list and personal list. What we've done especially is we put our usual vaccinations here, 6-month immunizations right here, so we can click them all. Bammo. You can also order a flu vaccine if it's the right time of year. We don't have those in yet, obviously. And then you can click follow up in 3 months. And that's it. You ordered your vaccines, you ordered your follow up. You could order any of these other little comments that you may have done. What else should I show you here? Oh, we see some children who get their vaccines through the VFC program. So those could be ordered through here. Okay. And then we're done with our well child. Okay. And this is, again, user configurable, but we have our work plans automatically order up essentially a V code for nutritional counseling. This satisfies some of our insurance company requirements that we're going to build this V code up there. And you can add some comments under that if you want to, although we usually don't. And we're done. We're finished with the well check. You can look at the billing now if you want to. Normally you wouldn't because this is very reliably correct. But for instance, we've got the hemoglobin screen. We did the developmental screen. We did a finger stick. Here's all our vaccines we're giving. Oh, and here's our vaccine first component and another first component vaccine. We should have our, here's our additional over here. And all of this is done automatically. These vaccine admin codes are generated automatically, and they're actually a pretty significant source of income, so you want your EMR to do that automatically. You guys shouldn't have to be picking those things out. Okay, that's that. I think she also had this rash on her face. We kind of ignored that, but just for the sake of adding this in, let's say that we also diagnosed eczema. So that of course should have appeared on our physical exam, but I forgot to do that, honestly. It's on our short list of sick assessments here, but if it wasn't, and I started to type this a moment ago, you could search for your favorite assessment, but here it is, eczema. And here are some of our favorite things we do for eczema. This business down here, for those of you not from Georgia, we see a lot of patients who get their health insurance through the Medicaid WellCare program, so we set up these preferred categories so we're sure to prescribe basically the correct steroids for eczema or for other conditions that are actually covered by WellCare. But that's why it might look a little odd to you, but that's why we set it up, and it's a huge money saver, huge time saver, because we don't have to keep looking this stuff up. So if you want a class 3 steroid, one of those two, either of those two will be covered by WellCare. We set all that up. Let's say we're going to do a dermatology referral, and we're going to put this kid on Acclimate. And we also talked about minimizing the length and frequency of baths. Okay, done. This double checks our dosing on that Acclimate medication. We might put in duration, PRN rash there, just to flesh that out. And here we go. So I'm pretty confident that we're done. But the neat thing is that although we're done and I'm ready to leave the room, there's still a lot of other things that have to take place, but I really don't have to worry about them. I'm going to click exit. I'm going to click I'm finished. You might look at that and go, wow, look at all that stuff, but it's all important stuff that has to get done. So let's go through these. Again, this Acclimate manual print, ordinarily there would just be a little white box here to send it via SureScripts, but I guess that's not configured for this test patient. Give out sheet dermatology referral. You may remember I ordered dermatology referral, so the people in green up at the front, they know to give out that sheet, so they will click it. And I'm not an admin front desk, so it's asking me if I want to take over. Ordinarily, you wouldn't get that. And then the nursing staff has to enter in the vaccine information, like that rotavirus. She'll put in the lot number and other things here. There'll be a literature date. That's the date of the VIS thing. She'll type, and well, anyway. A lot of this will be pre-populated, honestly. Yeah, normally the lot number just pops up here, but it isn't in this case because it's a test patient. You know what? I'm not going to type in a weird lot number because I'm afraid that later today real patients will get that lot number, and I don't want to confuse anyone. So I'll just hit I'll be back and leave it for the roll. So, but all of these bars are sort of picked off one by one. The nurse will click this, enter the lot number, click this, enter the lot number. This grits has to do with this Georgia thing for us to send the information to the registry, and then the nurse will click here, capture a signature. There's the vaccine information acknowledgement, understand the risks and benefits, and sign. And I'm working from my desk, so I don't have a capture device. This may look really weird, but I'm just using my mouse. But in the exam rooms, we have a capture device, and that's gone. And we also have our front desk people ask if they've made their next well check appointment, and take care of everything else they need to do. And I'm done. No light blue here, so I know I can move on to the next room. Quick, and that's it. And that's a well check. What would be helpful? How much? I don't know how much more time you want me to demonstrate things, or there are other features you think would be good for me to show now. Or questions from anybody?
I think it's great, Dr. Benark. I mean, I see that maybe you could just talk about how these pink and green things work. for your office staff when there's, 5 patients in the office or something? Do they see?
I think that I'm tempted to show you. It's kind of a HIPAA violation. I guess I shouldn't. To show you my real office, what you would see is many of the rooms have patients in them, and then they have these bars saying what needs to happen. When Teresa patient goes up to the front front desk person will finish these things, and then she's gone. She'll offer to schedule this, and then she'll, what we say in the lingo is they tick off the bars. And once the bars are done, the patient's gone. Everything that's done has been done. The bars are pink, tells the nurse to do something. Green tells the front office staff to do something. And then the doctors have a bar in a different color. Just as an example, if I wanted, let's say I wanted one of my partners to poke their head in there and look at this rash. Well, you know what? I want another part. I'm just giving you a crazy example here. I could make a bar for Dr. Marianne here. Please look at rash, okay? And I put that in there, and there it is. So Marianne knows that this lovely maroon color is hers. So as she's in between patients and scanning the telephone room and the pods, she'll say, oh, that's my color. And then she knows that there's something I want her to do. And she can go there, and then she can touch that bar and finish it up. So these colored bars are honestly nothing short of magical in that they keep everyone, the doctors and the front office staff and the nurses, if you had a respiratory therapist, if you had a pharmacist, if you had a radiology tech, there might be all sorts of people, depending on the setup of your office, who have things to do, and you have to tell them to do things. But doing, like, if you think about like email, you have to get out your phone, you have to look for your email, you have to touch the message. It's not just that they're told to do something. They're told very explicitly, just at a glance, okay, I need to, for instance, here's my mouse, I need to give this vaccine. So I can go over to the refrigerator, I can pull out a dose of that, and then I can click on this and put in, oh, see, this one was populated by the lot number, and the literature date should pop up right here. And then you hit immunization given. Without giving, okay, I do have to put a date in here. I'm kind of messing with this a little bit, but normally the date pops up in a real patient. And you hit that, and now it's gone. And if you notice, the bar that used to be there is not there anymore because the thing was done. So the bars are created when things need to get done, either explicitly or by the work plan. For instance, reminding the nurse that a 6-month-old needs a UA, or a 6-month-old, needs a finger stick, or a 5-year-old needs a urinalysis. Those are put up there by your work plan, which kind of guides the nurses, so anybody else tells them what they need to do.
That's great. So I guess any nurse can look at any patient and say, I'll jump in.
Exactly. Now you're getting the magic of this. Right. I don't have to go tell my nurse. In fact, I don't have to go tell any nurse. We typically, we have 2 offices. This one typically has 3 doctors and about 7 nurses working, and they can all help each other out. If, for instance, one doc is sort of getting backed up, the other nurses can kind of chip in and get their responsibilities done. The telephone room, too, we usually have at least one nurse whose main responsibility is telephone calls. But if you can see that this phone room is getting busy, any nurse can just pop right in the telephone room, pick off a call, and you could tell at a glance that this one, 45, has been waiting longer than this one, 19. So then you could say, oh, I'm going to do this first one. But we also put a little bit of text in here to tell each other what it is. So if this said, mom at airport needs call right away, then you would know to call that one first. And you don't actually have to click it to know that. I mean, the text, it tells you at a glance what needs to happen. You don't have to click to figure out what you're supposed to be doing.
So I'm not seeing you do a lot of typing. Is that pretty standard, that you don't have to do a lot of typing?
Yeah, some of my partners, now as it turns out, I do type. I actually type very well, but I can get through entire encounters without typing a word, and I have some of my docs are not particularly gifted typists, so they rely more on the pre-configured lists, the lists of words that you can just touch word, and put together your text. Now, since I don't actually use that much, my lists that you saw weren't very robust. They weren't very long. I think some of my other docs have done a better job creating lists that work for them. But I don't use that a lot myself, honestly.
And so is that something that Excite Health sits down and does with you in advance, or?
You know, you can. You can sit down and think through the kinds of phrases that you want to put there. But in a way, it's almost easier to do it as you're seeing the patients, because that's when you're thinking about, what do I usually ask? And it really is quick, just on the fly, to add those words, add. So in truth, I think I'm not sure. Thinking about this, for me, I think I do most of that adding just when I'm in the exam rooms. Like if I'm with Tamara here, and what was her? I'm trying to remember what did we do to this poor girl? Oh, this was, you know what? This was a telephone call, but that's an encounter as well. And we mentioned this exposure to communicable disease, and when I went in there, I realized that these are the common treatments. There were none because I just haven't bothered to configure this. But this is how long it takes to do it. Let's say that we often, for this diagnosis, prescribe Cipro. Okay? So here's my prescription for Cipro, and let's just assume it's an adult, and we're going to use this for prophylaxis. So what I do is I click on this icon there, update the list, done. And now, forever, if you get this diagnosis, exposure to communicable disease, Cipro is going to be suggested as a treatment. It's part of it. I've just added it to the common list, and it's there. It's done. And that's how long it takes to add things to these lists. Very, very quick.
So it's really built upon how you practice medicine, whereas another doctor could have a different drug that they always recommend for the same.
Right. And you would decide as a practice. Now, what I happen to add this under the common list. This is the list that me and all of my partners will see. But you can also generate, just to the left, see this tab here, personal list. If for whatever reason you're the maverick doc in the practice and you like to, when there's exposure to a communicable disease, the first thing you're going to do, I'm just being silly here, but you're going to give a Gardasil vaccine. Let's just say, okay? Click there, add it to the list, and now Gardasil vaccine actually sticks to the personal list of this diagnosis. If I make this diagnosis again, this will be sitting there waiting for me, and all I have to do next time, it'll look just like this, and I click it, boop, there I've ordered it. It's done.
Okay, so you've got some questions that have come in, so I'm going to run through a few of them and then turn it over to Barry. So do you finish charting the encounter while you're in the room with the patient, or do you do it after the patient or parent has left? Like I know a lot of doctors have offices, and they kind of go there in between patients and fill out their paperwork.
I don't like to do that. I really do prefer to do it in the room. I think the charting is more accurate, and I think that as a habit, I like to say out loud what I'm doing as I'm doing it, right? So I'll say, okay, so what I want you to do is da-da-da-da-da, take shorter baths, don't soak in soapy water where we're talking about eczema. Or I'll say, and now I'm going to order a Gardasil vaccine for you. And as I say it, I click it. And that way I don't make errors, and the nurses and the patients aren't surprised. I say, you know, I say it as I do it. It's all in the chart. It's all clean. And the charting is so fast. I think it would honestly take me longer to walk to my office and sit in front of the computer than it would to just, you know, click, 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 click. I'm done.
Okay. In the same sort of vein, many providers, patients, and parents there's another question, have complained that while the provider is charting, either nurse, physician, or whomever, in the electronic health record, it kind of takes away from the interaction. Do you feel you still have good eye contact interaction while using Excite Health EHR?
I think that is a new challenge for all of us, for doctors and nurses, in that depending on when you went to medical school, you were used to having a different style of interaction. What I try to do is briefly look at the computer to get an idea of what the problem list is, what's on my mind, and then really walk away from the computer, focus on the patient, do my physical exam, talk about the history, and then I can go back and enter the information. So I definitely like to keep the patient engaged. When I mentioned before that I talk out loud about the plan, that's only when I get to the plan part, to the screen you're looking at now. When I go through a screen like this and I say, okay, I'm going to, you know, this isn't the most useful screen. Let's do something. Let me show you a different one, you know, a more ordinary. Let's say we're going to do a croup Okay, so let's say, oh, your child has croup, so I want you to, it should get better within a few days, so croup course discuss with parents, and I'm going to prescribe dexamethasone. And I do that standing in front of the computer, click, click. But that's a very small part of the encounter. It just takes just a moment to do what I just did, and now I'm done. Oh, okay, well, this patient, okay, normally you don't see the screen because this was a telephone encounter, so we didn't know her weight, so it doesn't know how to dose the dexamethasone. I'm just going to cancel out of this. But ordinarily, you wouldn't have seen that screen. But ordinarily, we probably wouldn't have prescribed dexamethasone over the phone for croup either. Okay.
Right. So when you're hiring a new provider, physician or nurse or any other clinical staff, how long does it usually take that person to get used to charting in the Excite Health electronic health record?
The system is very, very fast to learn. For nursing staff and for receptionists, I literally don't do any formal training. They pick it up while shadowing some of my other staff for a day or two for the first couple of days of their employment. They're shown what they need to do, and they pick it up, and they're done. That's it. For new physicians and new nurse practitioners, we do formal training. And for the last several I've hired, I do two-hour sessions, 2 hours, and then they can continue to practice with it either from home or from the office. Then I do a second 2-hour session to go over things with them again, reinforce some things, and I found that is plenty of training. The last doc we hired, which was only a few months ago, I think within 3 weeks, she was seeing an absolutely full slate as quickly as seeing patients as she was at the practice that she had previously been with.
Great, great. I've heard some people talk about this system or other systems in regards to a term called workflow, and I would imagine that most people say, well, what the heck is workflow? But having seen this demo today, I kind of understand it a whole lot better. So can you maybe describe what you call workflow or what you call the beauty of this system?
You hear workflow. I admit that as a doctor, part of my brain thinks that's just kind of like a marketing buzzword. It's just one of these words that is associated with electronic records. But it really does have a meaning. And I guess what it comes down to is can a health record like this actually help? Are you doing it just because you kind of have to, and you have to meet meaningful use, and you're sort of being forced into doing it? I think some people are in that boat. But more important to me, an EHR that actually helps with workflow, it's more than just making a chart. It's actually helping you run an efficient business that provides good medical care. It keeps your patients happy. They don't have to wait. It keeps your nurses happy because they can stay efficient and work. They don't want to sit around wondering what to do either. They don't want you yelling at them across the hallway. That's a HIPAA violation too. Get in there and give a vaccine. You don't want to have to do that. The beauty of the workflow is both in situations that are automatic and in communicating instructions to the rest of the staff. So automatic work plans or automatic workflow are things like, let me think of an example I haven't shared. Okay, here's an example. I could click on this. I'm just going to describe this to you for the sake of time. But for instance, we decided, this is going to be a workflow thing, that when we order a laboratory, we want someone from our staff to check to make sure that the patient really went to the lab and got it done. And the way we did that was we made an automatic workflow that when a lab is ordered, it makes a little task, like one of these bars, a little task for one of our employees so they can go through these tasks and make sure that they were connected to a laboratory result. When laboratory results come in, that little task goes away. So if the laboratory result doesn't come in, the task is still sitting there, and 2 weeks later, we can generate a phone call or a letter or whatever's appropriate for that circumstance. So that's a workflow in that this takes place kind of behind the scenes. I don't have to remember that this patient had a lab. Oh, did they go get their labs? I don't even have to think about that because I know that the workflow is going to force the logic of the machine is going to make sure that it was done. And then, of course, there's workflow that's generated as part of these well encounters. So patients at a certain age need a developmental screen. Or let's see, if I'm seeing a patient with asthma and I want my nurse to come in and do asthma education, it's a this is a very simple workflow, but the workflow is just a pink bar to that staff member to go do asthma education. Or, for instance, I could attach a workflow to a new prescription for an albuterol MDI. So next time, whenever I prescribe an albuterol puffer, I also want a pink a workflow to fire off a pink bar to tell a nurse to teach the patient how to use it. Let's say I wanted to do that. That would be very, very easy to do. I could attach that little bit of workflow to all new albuterol prescriptions. Very simple.
Great, fabulous. So I'm going to let Barry talk a little bit more about some of the features and some of the things he's heard from other physicians. So we're just going to switch the presentation over to him and the very last slide deck. And I'll still encourage anyone who's listening to send in questions because we do have a few more minutes. Barry, you just grab the last tab up at the top. And we're also going to put up a little survey into the chat box. And we really would appreciate your feedback on your thoughts on today's webinar. So over to you, Barry.
Hi, good afternoon, and thank you very much for attending. And thank you, Dr. Benarak, for the great demonstration. I would like to, even though we're focusing today on the EHR, I would like to give you a quick highlight of Excite Health. The EHR you just saw, it's an award-winning workflow management EHR. It was developed by pediatricians, for pediatricians, even though today we increased the scope of the specialties that we cover. The Excite Health platform is more than that EHR. It automates the entire healthcare practice with user-friendly features that will be demonstrating in following other modules in following webinars. They're all customizable EHRs, PM, and patient portal, as you just saw, and they all efficiently feed the billing and the RCM services that we offer to maximize revenues and lower costs. We have additional modules that we have not covering here, like HR, inventory management, that will help further manage the practice and lower the costs of running the business. Today, like I said, we want to focus on the EHR and the top 6 things that we think that any doctor needs to consider, and we are focusing on pediatricians. The very first one is obviously optimizing your time, and your time is for every role player in the practice. As you saw, the workflow screen presentation is configurable at every screen level. The assessment and the treatments are configurable, and they are configurable to the individual user, whether it's the nurse, whether it's the front office, or the doctor, just like Dr. Benarak has demonstrated. Evidently, optimizing billing is key. That's where you generate the revenues for the practice. And with the Excite EHR and PM, billing is seamless. Codes flow directly, like Dr. Benarak has shown, from the EHR to the PM for 100% accuracy. And we're currently updating clients with ICD-10 coding. We already started releasing codes for the doctors to practice. And we are offering a complete RCM service for practices who are interested in it to maximize revenues for the practice. Balancing your practice. In order for a practice to be really efficient, not only that you need the intuitive charting based on assessments and treatment plans, just Dr. Benarak has demonstrated, but the simultaneous, synchronized tasking that occurs with the office staff. Like you saw when the doctor was ordering vaccine or we're ordering certain tests, this is the office view where you saw all the bars with the colors. This is like a dashboard, the office view, we're calling it. And every role player, as the doctor has mentioned, you don't need to call the nurse and say, do this or do that. Everybody has this screen, they're looking at it, they're seeing the colors, they're seeing the tasks, and they're acting on it. So the system delivers the right task to the right person in real time, so the practice stays synchronized and balanced. Balance your life. You know, everybody wants to have a good quality of life, and they don't want to get overwhelmed with charting. Don has asked the doctors whether he charts the patient while he's still in the room or not, and the doctor said that he likes to do it in a room, and the system allows the doctors to actually complete the entire charting while he is in the room in front of the patients. That obviously makes the patient wait less. The patient satisfaction increases. The work output increases. We have heard from our doctors that being able to see more patients during the day, increase revenues. Physicians feel more in control of the practice, and in this way they can take back control of basically the demands of their practice and go home on time. And the most important thing is the best patient care. The Excite EHR work is not only a workflow management system, but the fact that it's highly configurable and present the right information, the right task, in the right time to the right person, it keeps the team happy. It gets the job done on time. Each encounter has its own screen config presentations, and everybody can finish the job and go home on time and be happy. So, like we said, the ease of use and user-friendly features is paramount. The Office View dashboard that we have shown make it all happen. Everybody, all eyes on the same target, the same screen, same tasks. And all this has been accomplished by developing by pediatricians for pediatricians. And we'll take questions now.
Great, thanks, Barry. And I guess because it is so configurable, it can definitely, as I know you already have clients that are not pediatricians, it can definitely go beyond helping pediatricians for sure, I think, right?
Yes, we have other specialties, obviously general practitioners, we have OBGYN, we have allergies and other specialties as well.
Okay, great. So I have another question here. So when the data from the, and we'll have to unmute Dr. Benaroff as well, when the data from the electronic health record is compiled, so maybe this is more a Barry question, but anyway, are results standardized in any way, given that each user can customize some parts of the record? How does this measure up with interoperability rules? I know that the interoperability, for me, I'm just saying a side comment, that the interoperability rules are still trying to be figured out and make sure everybody can talk to each other. But the last point that this person says is the system seems very, very user-friendly, nice work. So Barry, did you want to take that on about standardized results, and given that you have customization as well?
Well, we're actually...
Tracy would like to chime on it.
I'm the product manager. Actually, we have standardized a lot of things behind the scenes where the provider still has configurability, but we have the LOINC codes that have to go with the labs and the SNOMED codes that go with this. And as a matter of fact, our ICD-10s are pretty much based on SNOMED, on a SNOMED concept. That's all done kind of behind the scenes, so the provider doesn't have to worry about it. It goes the way it's supposed to.
Okay.
With all of the portability information.
Great. So it's a behind-the-scenes activity where their choices are driven up front, but their choices fall into certain standard processes and algorithms and things like that.
Right.
Okay, great. So maybe just one last question to Dr. Benaroff. I kind of saved this one for last because I thought it was a good concluding remark, unless anyone's going to send in some more questions. So Dr. Benaroff, what do you like the best about the Excite Health electronic health record and system? We can't hear you. A little bit closer.
Sorry, guys. I was trying to I was trying to have my lunch here too. Sorry about that. Okay, you know, what it's really best at is helping run a practice well and keep everybody going forward. It really does a wonderful job making it so that everyone can work at the same time. There's always something that needs to get done, both for the doctor and the nurses. I don't have to wait for the nurses to do what they're going to do before I can go in and do what I can do. I don't know if I'm explaining that super well, but the idea is that we all work in parallel. We don't have to wait on each other to tell each other what to do, because the EHR takes care of that. And that office view is very, very powerful. Those colored bars, at first you might say, wow, there's a lot of color there, but there's sort of a magic to it. People get very used to seeing their color, and your own color just catches your eye, and you can tell almost from across the room that something needs to get done. It's not just a matter of getting things done, though. It's also keeping the patients moving. I think it can really minimize waits. We can see more patients this way, and we can keep them happier. Nobody likes to wait. We've all been to the doctor. Everybody hates waiting. And if you can keep your patients from having to wait because the nurse efficiently knows what it is they need to get done, what they need to do first and what they need to do second, it makes everybody happy, makes for a very successful practice.
Yeah, I look at it and I think, well, my brain is pretty full, so I'm imagining that a physician or a staff person in your office, their brains would be pretty full with all kinds of things to consider for every single patient. And I love the fact that there's sort of these checklists that you can create for how you want to practice medicine and the things that you want to remember to do, like give out literature, et cetera. Like, I was looking at some of those lists thinking I've never had those sorts of things be given to me by, some physicians I've seen. So, you've got the things to make you remember everything you want to remember and then remember to do it as well, which is really 2 steps.
Absolutely.
Yeah. So any last comments from you, Barry? And
no additional comments besides the fact that it's important, even though we did focus on the EHR today, the practice management and the patient portal are integral parts of the practice comprehensive experience. And the fact that they're automated they're automated in order to make the experience of the staff, like I said, easier, the patient satisfaction higher, increase revenue, and lower the cost of operation.
Great. Well, thanks everyone for your time today, and thank you very much to Dr. Benarach to share his insights and how easy the system is to use and how it makes your practice run so much more smoothly. And if anyone has any questions, you know where to find us. Just reply back on the email from the webinar, and we'll be continuing to share some of the great components of Excite Health over the next while. Thanks everyone, and have a great day.
Thank you, Doctor, and thank you for all the attendees. Thank you, Dawn, for moderating it.
Sure. Thanks, Dr. Benarach. Talk to you.